Hello, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. Today we decided to change things up a little bit and field some questions from a Facebook post John made yesterday. So we're going to jump into that. We got several questions, so stay tuned and we're going to answer all of those.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
All right, it's the first week of May, which doesn't seem possible. And we started the first week of May out with a bang. We had our farriers here last week, thank God, because we had a terrible dystocia come in Friday morning, and it took me and my father and John and two farriers to get that baby out. So two vets, a couple farriers, but sadly the baby's galloping in the fields of heaven, but the mare is doing quite well. So I will consider that a win. It came out breech. It was backwards, but with a lot of willpower and the knowledge of Dr. Ron Beasley, we got that thing out of there, and some brute strength from the farriers and John. And we also had a red maple leaf toxicity horse come in Friday night. Sadly, he did not make it. So starting May off with a bang, huh? First question comes from Alex Longian, as we call him, Dr. Longmire. He's a friend of mine. I met at Dr. Brock's clinic in 2013. He was an intern. He worked for the University of Illinois for a while. Now he resides in Louisiana. And he wants to know why that mare is giving me the side eye. And I would suggest you stand in front of the mare, Alex, or quit stabbing it with needles every time you see it. The next question is from Lacey. Ticks! Exclamation points. Why are ticks so bad this year, and what are some good preventatives? I don't know why ticks are so bad. It seems like every spring we say, God, the ticks are bad this year. And they are. As far as preventatives, there's a couple commercial products you could spray in your pasture that may kill them if your pasture's small enough. There's Ultra Boss and Equispot, which is a pour-on product. The ticks will still bite them, but when they bite them, they die. I think a couple of them claim they may prevent them. I don't know how true that is. One other thing we will do, and we may get, the parasitologist may crucify us for this, but sometimes we'll recommend people that their horses are getting ate up by ticks deworm or give their horse a dose of ivermectin once a month during the summer when they're real bad. It kind of, and the pour-on products work this way too. Kind of think of the front line for your dog. It's circulating in the body, so when the tick bites them, they ingest it, and then they die. But they will still bite them. And are we building resistance to ivermectin doing this? Probably. In my experience, ivermectin doesn't work that well for worms anymore. We use a lot of moxidectin, which is ivermectin's younger cousin. But you can do that. Hopefully you don't have to do it too many times. Some people will take 7 Dust and put it in a sock and kind of sprinkle the mane and their tail head with that. That's pretty safe for horses, and that can work. But why the ticks are so bad, I don't know, but they are, and I hate them, and I get a lot of pleasure out of killing them when I pull them off my beagle. Harper wants to know, why do some geldings get disgusting sheaths and others don't? Don't quite know the answer to that. Some of the beans we take out, which is basically schmegma from the sebaceous glands in there. I think some horses just have overproductive sebaceous glands, and that's why we are cleaning their sheaths every spring and taking out big beans. Some of horses are just more dirty. They may lay down more in the mud, but that's just kind of it varies from gelding to gelding. Some we clean every spring. We don't have much to do. Some we're always taking a big bean out, and we got lots of cleaning, which I will give credit to our awesome tech Autumn. During a routine sheath cleaning, she did notice some very small squamous cell carcinomas popping up on a penis the other day. And that's goes into the thing about routine sheath cleanings and knowing what you're looking for. It's worth that extra few bucks to have your vet sedate your horse, let them drop out real good, where they're not going to risk their hand getting broke by a back foot, and getting a good look at everything to try to catch those things before it's too late. She also wants to know, why does her one gelding like to wing it out every time you brush him, or his feet gets trimmed, or the wind blows sideways? From a medical standpoint, the only thing I can think of is, depending on when they castrated him and how they castrated him, it's always possible there's a testicle in there and he's still got some testosterone floating around and he still thinks he's a teenage boy, or it could just be him. So don't have a great answer for that, but if you're looking for a medical reason, cryptorchidism, where they've got a testicle in their abdomen, I would think you'd have other signs like aggression, trying to breed mares, or maybe he's just really fond of you. And she also wants to know about feed-through fly control. Do they work, or the blocks are tough? Yes. Short answer is yes. Purina makes one called Clarifly. It works. We use a product here in the clinic when we keep horses for extended time called Solitude, which is a feed-through. So when the horses are excreted in the manure, the flies land on it, and it takes care of them. When we had some resident horses here, we fed that to them every day, and we did notice quite a big reduction in flies with that. So as far as the feed-through stuff, I think Zoetis makes it. It's called Solitude. Great product. It does work, and it's safe, and it's easy. It's a little bitty scoop you had on their grain. I've never had a horse not eat it. So there you go. Kaylee, how important is gut health? How important gut health is? I haven't had much sleep this weekend. How important gut health is, and if there are any ways to keep healthy gut in horses without expensive supplements. I'll refer you back to episode 2, I think, where we talk about EGUS, which that's just talking about the stomach mainly, but a lot of the stuff we talk about with the roughage has to do with hindgut ulcers too. I think part of it is making sure they got enough roughage in their diet and things are moving through, and the feed you're feeding is a good balanced ration with not a ton of carbohydrates that can get fermented in the gut and produce some stuff that is not beneficial to the guts. Probiotics can help with stuff like that. She also mentioned some supplements. They're using 100X. I think it's GutX, they call it. I don't have much firsthand experience with this, but I've talked to a lot of vets who have scoped, for the stomach at least, a lot of horses on GutX, and they'll flat out tell you it doesn't work very well for preventing stomach ulcers. Now, I think some of the stuff in the product makes their hair coat look good and kind of shines them up, and I think there's hyaluronic acid in it, so maybe they do get a benefit from it. But from a stomach ulcer standpoint, I do not believe that it's one of the better products on the market. And she also asked the best option for building up good gut health in large herds, do's and don'ts. Again, plenty of good, high-quality forage for them, whether it's pasture or hay. So the do's, that would be the do's. The don'ts, don't believe everything you see on Facebook. Shelly wants to know about fly control. If you're in Southern Illinois or any place like that, the flies have came out with a vengeance lately. She wants to know, are there any fly sprays that work? And God, I wish I had the answer to that. With the horses here and my own horses, it seems like we'll find one product that works really, really good, and then it quits working. And then something else may work good. I switched brands late last summer, and it worked great. I got that out this spring, and the flies just seem to feed off of it. So I think it's important to kind of switch those things up. Be careful with some of the oil-based ones, because if you're like me, you're like, oh, a little's good, a lot's got to be better. But some of those can be a little bit caustic to the skin. And I think that'll allude to your next question, too. She also asked about the fly boots, which are the kind of mesh-looking things that you put on. They Velcro on right over the hoof and go up almost to the knee. Those do work. They basically just there's just a barrier for the flies. They land on those instead of the legs. And when it gets super dry this summer, we'll recommend that a lot, because the horses will stand there and stomp those flies to try to get them off their feet. And their feet are already dry, and we'll see hoof cracks and problems like that. So yes, the fly boots work. Just do your research, look at which ones have the best reviews. I know some clients of ours just bought a bunch of them off Timu, so we're waiting to hear back to see how those held up, but I know they were dirt cheap. So those are a good idea, but the other thing I've seen with them is be sure you're checking them, especially if your horse is stalled or in areas where they can get dirty. Take them off every now and again. Clean them if they're in wooded areas. We had one horse come in that was lame. He was limping. That's why they called. We took the fly boot off, and there was a big old stick in there. And I think that's why the horse was limping. So anything you're putting on your horse, whether it's a blanket, soft ride boots, take them off periodically, daily, ideally. Just kind of clean them out, make sure nothing bad in there. Because if you know horses, they're really good at finding stuff that they shouldn't and putting it in places that it shouldn't be. And she also asked about cannon crud, which I believe what she means is on the front of the cannons, mainly the back legs, they kind of get that crusty scaling looking stuff on there that can look like kind of like rain rot or infection. We also call that cannon dermatitis, which cannon's just that bone back there in that area. Dermatitis is inflammation of the skin. Derm is skin. Again, itis is inflammation. It's also, depending on the specific case, can be called cannon keratosis. And it's nothing infectious or contagious. And it's all breeds. It's not, some people call it stud crud because they think it's the urine dripping down that splashes. Maybe that plays a component in it, but mares can get it, geldings can get it, every breed can get it. You get like an overproduction of keratin, which is kind of like a natural protein, and that can build up and it gets inflamed. Like I said, a great place for dirt and debris to get trapped. So you can get a little infection in there too. If you look it up, there's a lot of products that claim they fix it. Really just any of them that kind of cleanse the skin, clean it. Maybe a topical anti-inflammatory will work. And then the sebaceous glands I mentioned earlier, you can get an overproduction of oil there too, which again will trap dirt and debris and lead to the dermatitis and maybe even infection. So they're not too big a deal. I know it's an eyesore, but keep it clean, cleanse it gentle with a mild soap, even ivory, dry it. And this time of year, our pastures are long. They're wet in the morning. They're wet all day now because of the rain, and that moisture just kind of sets you up for a dermatitis. So that's the cannon crud. Fly boots do work. In fly spray, just find what works for you and your horse. Don't overdo it. We have seen some horses come in with the oil-based product that get a terrible dermatitis from it. So a little judicious with your use and switch it up every now and again. Donna asked about white line disease. Can you cure white line disease? Yes. White line disease the white line is basically the lamina we've talked about in previous episodes, where it gets a disease process. You get an anaerobic bacteria in there, which anaerobic means the absence of air. An is the absence, and aerobic is the absence. And the bacteria, or fungus can be too, will thrive on that absence of air. So the treatment of white line is getting air to those areas. The air will actually kill the bacteria. How do we get air there? We do hoof wall resections, which we'll take x-rays and see how much is affected, because there's the hoof walls kind of rotting away. We'll see black in there because of the lack of tissue. And what we'll do is sometimes you got to do a nerve block, sometimes not, but either take half rounds and we basically cut out all of the hoof that's affected to get air to it. And some of these horses, we're taking off most of the front of the hoof wall, and it looks terrible. But if the cannon bone or the coffin bone isn't affected, meaning it hasn't let loose because of all the lamina being affected, most horses do just fine. When that foot grows out, it'll grow normal. So yes, we can cure white line disease. The earlier we see it, the better it is. We don't have to trim as much hoof wall. Next time we do one, we'll make a video on it, but depending on the amount that's affected, we'll take half rounds and just start cutting that hoof wall away. Sometimes you got to take a Dremel and get in there, but getting air to it is the main thing. So if you think it's white line, of course, call your vet first. What you don't want to do is wrap it, because you're going to trap moisture in there and you're going to keep air from getting in there. So if it's white line, we can fix it. Don't wrap it. Call your vet. We'll take some x-rays, see how bad it is, and remove all that hoof wall. Most of ours, we correlate when the farrier's here, Steve, because sometimes we'll have to put a specific shoe on there, depending on how much hoof wall we have to take off. And Courtney wants to know the randomest, craziest stories you have of horses doing dumb horse things. Well, there's no shortage of those, because everybody that has horses knows they have two things on their mind: homicide and suicide. Horses just invent ways to get hurt. One of the craziest things I think I've seen, a horse came in one Sunday evening that somebody shot with a crossbow maliciously. They were mad at the owner. They also shot his semi. That's one of the craziest things. We've had horses with gunshot wounds. We had a heel bulb laceration once that we had to put a foot cast in, a young racehorse. 6 weeks later, we took the cast off, healed great. We watched it. We cranked on it. Everything was healed. The next day, he called wide open again. So our first thought was, well, it didn't heal good. Did another hoof cast. 6 weeks later, he takes it home, turns it back out, but this time he watched it. She was taking her foot through the fence in the same spot. I don't know what she was doing, and just cutting it every time. So horses do dumb things, that's for sure. And our job is to keep them alive when they do it. She also mentioned choke. That's something we see quite a bit. Choke in horses isn't like when we choke. When we choke, we get something in our airway and we can't breathe. When horses choke, it's an obstruction in their esophagus, which is that long tube from the mouth to the stomach. And they'll choke for a variety of reasons. Some of them can have what we call strictures, where the esophagus narrows. So it goes from a big wide open tube and gets super narrow, and feed can accumulate there and can't pass through. They can also have what we call diverticulums, which is kind of like just a blind pouch on the side of the esophagus where feed will accumulate in. They can have tumors that press on the esophagus and things like that. That's usually not an issue with choke. I think there's only been a handful in my career that we've scoped that actually had esophagus problems. Mainly it's from either the horse not being able to grind up their food properly, like hay, and they're swallowing bigger pieces, and that's usually a tooth problem or teeth. And horses that eat like a real dry concentrate food, and especially those that gorge, the ones that just go in there and there's no stopping them. They just take huge bites. They hardly chew it. It's like my 3-year-old eating muffins. They just engulf it. And then the saliva doesn't wet it as good, and they're swallowing large amounts, and their esophagus just can't handle it, and it'll get plugged up in there. The way we fix them is pass a nasogastric tube. We go up their nose. They swallow the tube. We get the tube down to where the obstruction is, and we flush it out, basically. There's some other techniques, too. The horses that are fed a really good palatable concentrate, like Purina Senior, for instance, most of those, by the time they get to the clinic for me to work on them, have either fixed themselves or are close to being fixed, and we can dissolve it really good. Some of the feed that doesn't dissolve as good, we have a lot more trouble fixing those. And it's considered an emergency. I like to look at everyone, but when they resolve themselves quickly, it's not that big a deal. The risk with it is aspiration pneumonia, because if you've ever seen a horse choke, they'll have feed stuff or hay or whatever coming out of their nose, saliva, and some of them they act like they're dying because they're so distressed. The risk is that going back down the windpipe and getting into the lungs and setting up a pneumonia from that feed stuff. Babies can do it with milk, and those are really tough pneumonias to get over. So if your horse chokes, even though it fixes himself pretty quick, if he fixes himself, it's a good idea to have that horse looked at. We'll use a lot of antibiotics to prevent that aspiration pneumonia. And a lot of older horses get choked. I think a lot of it's because that esophagus is a giant tube in these horses, and it's a giant muscle. And I think over time, it's like every other muscle, it kind of gets worn out and doesn't have the capacity to move that food down as good. And a lot of older horses don't have the same grinding ability with their teeth. So we'll see a lot of older horses that choke, and they could have a loose tooth in there that's gone undiagnosed, where they're not chewing as good or not chewing as good on one side. And a lot of older horses can be more prone to Cushing's disease, which kind of dampens their effect to fight off infection. So an undiagnosed and unmanaged Cushing horse that chokes makes me super nervous, because they'll have a terrible pneumonia, but their body is not trying to fight it off. So if you see feed stuff coming out of your horse's nose, or they're stretching their neck out, most likely it's choke. A lot of times it's right after feeding time. So if your horse is older, maybe more prone to it, a bad tooth or bad teeth, we always recommend soaking the feed. You can make it like a mash. They can even drink it like a soup, and slowing them down. If you got one that's just a voracious eater, we'll put like the 2-pound salt blocks in their feed just so they can't get such a big bite. Courtney also want to know about traveling and trailering in extreme temperatures, whether that's cold or hot. It is surprising in the wintertime how warm a horse trailer, that's enclosed, not talking about the big open stock trailers, that's enclosed, how depending on how many horses you have in there, their body heat takes care of it pretty good. In the wintertime, we'll do like a lot of routine stuff like Coggins or vaccines in the horse trailer, and we'll freeze walking through the parking lot. We get in that horse trailer with a horse or two, and it's way warmer. And the same thing goes in the summer too. Make sure you got all the sides open that you can. Take out the fiberglass and everything like that, and just getting air in there. There's same thing in the summer. The parking lot, standing outside, it's miserable. You walk in a nice horse trailer that's got a nice top and can get air through there. It's usually several degrees cooler in there. But also stopping several times, getting your horses out, let them move a little bit, offer them a drink. That's a great idea too. And it kind of depends on what your horse is used to hauling. Some of these guys that are on the road every weekend, their horse is just more adapt to doing that. So if you have any questions on that and extreme temperatures one way or the other, call your vet. There's some things we can do to make horses sweat more. That's how horses cool themselves. So it's just if it's extremely hot or extremely cold, call your vet. Have a discussion with them prior to trailing long distances if you're concerned. And she also mentioned navicular. So it's also navicular disease, navicular syndrome, caudal heel syndrome. Kind of all means the same thing. Basically, any disease process in there around the navicular bone or the soft tissue that is causing a lameness. And we diagnose it by nerve blocks, and it's usually bilateral. In the classic navicular disease, it's kind of the chronic wear and tear. So you may have a horse come in, and it's always fun because it seems like the husbands and wife will argue. And be like, what have you noticed? And one will say right front. Oh, no, left front. And it just depends on which foot is hurting worse that day that they'll limp on. So a lot of times they're both right. It's both front feet. One hurts worse one day than the other. But what's pretty classic with those is we'll do a nerve block down there, numb that region, trot them off again, and they look just as lame, except it's the opposite foot. And that's a pretty classic presentation for navicular horses. As we won't dive in too much, we're going to do an episode with Steve Summershine, the farrier, on this. What we did notice, or what I have noticed, is the younger horses that have a ton of heel, we see that earlier in their career. And I think because you've got the deep flexor tendon going down under that navicular bone, which lives right behind the coffin bone and the pastern. So if the horse isn't using its frog, if the heels are holding that horse up, that deep flexor tendon is basically suspending that leg. And it's believed you can get like a pressure necrosis, like people get bed sores from laying down. That navicular bone is getting pressed on by that deep flexor tendon, which is supporting that hoof. And we'll see problems with that or some traumatic injuries. And we can x-ray and look at the navicular bone and get beautiful pictures of navicular bones. But there's so much soft tissue down there that's usually involved. Most horses that have change on x-ray on the navicular bone, when they go to MRI, I think it's like 80% or something, don't quote me, will have damage to the soft tissue down there. And the soft tissue is either the deep flexor tendon, what we call the impar ligament, which is a ligament between the navicular bone and the coffin bone, and there's a ligament on top of the suspensory bone. Some people call it the suspensory ligament of the navicular bone because it kind of holds it on down there and suspends it. We'll see that in a lot of these. And we can't see the ligament on x-ray, but we can see where it attaches to the bone, and a lot of times we'll see pathology in the bone there. And there's also what we call a bursa, which is kind of like a fluid-filled sac behind the navicular bone that deep flexor tendon goes along. And some of them will have quite a bit of pathology in there. You can get fibrosis where it's stuck. We inject navicular bursas. We inject coffin joints for these. Proper farriery is a great tool for some of these. And there's no one magic bullet. There's a couple shots on the market. An IV and IM bisphosphonate works great for bone pain, but if it's a soft tissue, like I mentioned earlier, it doesn't do much for that. So navicular is a whole different can of worms. It can be frustrating. It can be manageable. It cannot be manageable. And the progression is hard to determine too. And a lot of older horses we look at, the navicular bone is dynamic. It'll change over a horse's career and use. So just x-raying a horse, whether it's a pre-purchase or just to see what the navicular bone looks like, really can't diagnose navicular disease. They really have to be, there has to be a lameness associated with it or significant pathology on x-ray from an injury or something like that. So that's all the questions we had this week. We'll keep it short and sweet. I'll just remind you guys to go to our YouTube channel. We have 2 of them. We have Beasley Equine Clinic, which is kind of our general videos, educational stuff we make. And we've got a separate Beasley Equine Podcast YouTube page that if you're watching this, you're on right now. Like that, subscribe to it. That's a great no-cost way to support our podcast and our cause here. If you're able to leave reviews on your podcast platforms, do that. Tell a friend, and we'll keep this thing going. So John and I were talking about maybe doing a Q&A thing the first Tuesday of every month. So look out for our Facebook post for that. Follow us on Facebook, Beasley Equine Clinic. And if we do another one of these, get your questions in, and we'll do our best to answer it. So until next time, take care of your horses and yourself.
Veterinary surgeon or start to come quick. Draw the syringe